Hello, this is Soheila Rostami. I'm an oculofacial plastic surgeon and the founder of Sanctuary Cosmetic Center. I wanted to talk to you today about CO2 and upper eyelid or lower eyelid blepharoplasty. Unfortunately, the past few days I have getting some patients coming in with misinformation about CO2 and upper eyelid blepharoplasty. CO2 cannot, and I repeat, cannot replace upper eyelid blepharoplasty, which is a surgical procedure. And you may say why. They're showing that it can cause collagen retraction, and we can see that it causes the skin to retract. Yes, CO2 laser is a resurfacing laser, and it can do amazing job for your skin of the eyelid, but it does not cause that much change in your eyelid to prevent you having your upper eyelid blepharoplasty done. Now, you may misunderstand, we do make incision with the use of CO2 laser that we use for CO2 laser resurfacing. It can be as sharp as a knife and can be used to make the incision for the upper eyelid blepharoplasty. That's a different way of using CO2. Now, if you combine CO2 resurfacing, which is usually fractionated CO2 resurfacing, these days we don't use complete full ablative forms of CO2 since it can cause a lot of complication. Some surgeons and some dermatologists select to do a full ablative form of CO2 resurfacing, but majority of us these days, because we wanted to prevent any kind of complication, we use the fractionated form of CO2. So that's what I'm talking about when I'm talking about CO2 resurfacing. And CO2 resurfacing can be aggressive or it could be very mild form. So when it's aggressive, even with the fractionated form, we can put the pixelated forms in a very close proximity to one another that can appear as a full ablative form, and the patient's recovery is extensive. So now let's get back to upper eyelid blepharoplasty. We can combine upper eyelid blepharoplasty with the resurfacing, since the skin quality can be, as we age, changed. And to get the quality of the skin back to younger form, we do combine the upper eyelid blepharoplasty with the CO2 laser resurfacing. We can do the incision with it and we can do the resurfacing with it. And actually that would be a fantastic combination. But there are limitations to use CO2 laser resurfacing for different type of a skin type, for different types of a skin. Fitzpatrick have divided skin types to 5 or 6 different skin types, and depends on the pigmentation in the skin and how you respond to sun exposure. We identify you from 1, 2, 3, 4, 5, 6 skin type, Fitzpatrick skin type. And a lot of CO2 laser resurfacing is not safe for patients with a skin type 5 and 6, and sometimes even 4. Now, there are mild form of CO2 resurfacing that can be offered to the patients with a skin type 4, 3 and 4, and possibly very, very few 5, when they are completely prepared for the CO2 laser resurfacing. So I want you to be more aware of these misinformation out there that they're advertising that they can do upper eyelid blepharoplasty with just CO2 resurfacing. I can guarantee you that is not possible and will not make you happy. So I hope this was informative, and I hope you can make a good decision by having this information. Thank you.